Good afternoon, everybody, and welcome to this part of Health Careers Live, where we'll be talking about career changes and becoming an allied health profession. And I just remind you, if you want to make any communication, that the hashtag we're using today is hashtag Health Careers Live. My name is Paul Chapman, and I'll be joined by some colleagues, and I'll talk about those colleagues in a minute. But what we plan to do this afternoon is to talk to you about individuals who may want to look at a career change to become an allied health profession. And we'll talk about what an allied health profession is, and my colleagues will help to support within that progress of how we go forward. So, as I say, we want to talk about changing your career to that of as an allied health profession. And you can see there's some characters on the screen there, and we'll be talking about those characters because they make up the careers of an allied health profession. I'm going to be joined today by colleagues Zoe Grant, who is a lecturer, therapeutic radiography lecturer at University of Suffolk. But the thing about Zoe is that she actually is a career changer. She's an individual who had a previous career and has taken up a new career and is now working in that as a therapeutic radiographer. I'll also be joined by my colleague Faye Lane, who also works for Health Education England, and she can help to talk about some of the support and the things, the anxieties that are out there, but also we can touch on the subject of apprenticeships. Let me introduce myself. My name is Paul Chapman, and I am the programme lead within Health Education England, but I am also a clinician by background, and I'm a physiotherapist. So hopefully I do understand the subject of allied health professions. So the aim of the session is to understand what and who an allied health profession are, how Health Education England as an organisation can support allied health professions as a key part of the key workforce infrastructure in both health and social care, why people change careers, I'm going to be talking about that, but also why they become allied health professions and how your skills that you currently have in your current career are transferable across to that of an allied health professional, and understand what we have to offer as a career changer. So who and what are allied health professions? Allied health professions are made up of 14 individual health professions. Now in the NHS, commonly we hear about doctors and nurses, but the NHS is actually supported by over 350 different types of professions. And of those, there's 14 key professions which support patient and population care and health going forward. Combined, allied health professions make up the third largest workforce in the NHS. Particularly, most professions are degree level, and going forward, eventually all professions will be degree level. And once qualified, you will be able to become an autonomous, what we call an autonomous practitioner. That means that you'll be able to work independently and you'll be able to use your skills and knowledge to do that. As AHPs, we provide a vast variety of support across the system. We help to assess patients. That means to look at them, understand what their problems are. We look to treat those patients. We can even diagnose those with those patients. We can discharge those patients. And that's the autonomy that we learn and have at our disposal with the skills that we develop over the number of years that we work. We'll work across a number of settings. That may be health, that's in hospitals or in the community, maybe social care, housing, education, but also the voluntary sector. So you'll find an allied health profession working across a number of variety of locations. We can help to manage our patients' care throughout their life, and that is from birth to end of life care. And you will find at some point an allied health profession will be involved with an individual during their lifespan. We focus on prevention improvement of health and well-being for these individuals. And the idea is that we want to maximize the potential that that individual has and the potential that they can give so that they have a valued life going forward. So what we have here is our allied health professions, and this is our characters that have reappeared. And do you remember I said there was 14 of them? Well, I was telling a slight porky because there's 15 specific professions. But when it comes to radiography, we tend to lump our diagnostic radiographers and our therapeutic radiographers together. Don't ask why. That's a decision that was made. Zoe, I'm sure, will have a view on that going forward. But the most important thing is that there's 14 individual professions here that make up allied health professions. And I wouldn't be surprised throughout your life or individuals that you live with, loved ones, etc., that they haven't experienced the care from an allied health profession. And it may be they've actually experienced care from a number of allied health professions throughout their life. And as you remember, I said before, we will be involved whatever the life cycle is of that individual. So the professions listed there, and there's quite a variety. So whatever skills and knowledge you've got, and whatever your interest is, I'm sure there will be something there for you as an allied health profession going forward. So what did we do? Well, we wanted to, in Health Education England, I wanted to understand why people were changing their careers. And we've got lots of research about why people have actually changed their careers. So what we actually did is we sent a tweet out. I sent a tweet out to individuals who I knew were AHPs. And I wanted to find out why had they changed their career and why had they become an AHP. So we sent a tweet out and we got a tremendous response from 80 individuals who previously had another career, but had then gone on to either start their career as an AHP or had actually been in the career as an AHP for a number of years. And they may have actually been using the skills from previous careers in their current career that they were doing now. So we started to notice there were some trends in those individuals, why they wanted to change their career. And one of the reasons is that people wanted to be able to show an impact on what they were doing in previous work, but they wanted to be able to work with a population or a group of individual. And the example being here is a dietitian that we have, and a previous role was that of as a restaurant manager. So it shows there is a transferability there. That doesn't necessarily mean that all restaurant managers will become dietitians. Restaurant managers can become therapeutic radiographers or orthoptics or etc. So it doesn't mean that just because you're in food, you continue to do food work. Also, the other things is that people wanted to show that they had the skills which were transferable. And we have here an example of an individual who was an IT programmer, and they wanted to work and they became an occupational therapist. So again, it shows that they wanted where they saw the work that they were doing was making an impact on people's careers. What we do notice is that a lot of individuals who've played sport become AHPs. And we have a classic example here of somebody who was actually a professional hockey player. Now, their interest may have been stimulated by the fact that they had come into contact with an individual who was an allied health profession. And it is more than likely that a hockey player like this would have had to have had an X-ray at some point. So again, it's sometimes that you actually meet AHPs through the work that you're actually currently doing, and that stimulates you to work with and become an AHP. So what this person, as you probably got here, is what Hillary did is she retired from her career and she wanted to pick up a secondary career as a result of it. So it shows that you can move from one area to another. Here we had an example of somebody who had experienced, again, treatment from an AHP and learnt about an AHP. And we have our colleague here, Ben, who has become an actor and is now a music therapist. So he obviously had skills that he was using, and he's now taken those skills and using them as an AHP. I wanted to use my technical degree in the way it helped people, and that's quite an interesting thing. Individuals will go off and do what they think is the career of choice in their early years, but then they find the skills that they've learned through the career that they've actually gained and the qualification they gained can actually be applied to other areas as well. And what we've got here is an example of an individual who was a photographer, and then they became an orthoptist. And an orthoptist is basically the physiotherapist for eyes. That's how I would describe that one. So again, he was using his skills around photography and how important vision was for individuals, and he wanted to be able to help somebody going forward. Also, on a very, very technical level here is we have an example of somebody who was a physics teacher, and they became what we call a prosthetist and an orthotist, who supported people with artificial limbs, etc. Other things is that sometimes people want to make a career change for job security, and we're fully aware of that, particularly with the pandemic and the way it's impacted on individuals and people who've been furloughed. What they're looking for is that job security that a career in health can give you. And here we have an example of James, who was an actor, and probably he would be an example of an individual during the pandemic who may not have been able to work. Therefore, he wanted a career where he got that security, and being a paramedic provides that security for him. I want to support people that in their most vulnerable time. And again, this is about being a caring individual, and you may feel that your skills that you have in your current career can be transferred to help people who may be more vulnerable. And Louise here, who is a drama therapist, actually worked for part of Comic Relief. So she had already experienced and was coming across the work of a drama therapist, and that's why she wanted to move on to become a drama therapist, because she knew she had something else to offer throughout her career. People also, going back to that vulnerability, may set off their career in one direction and it changes dramatically. And I would say this is a classic example of it's a person who has taken a law degree, but used that degree to support them in another area and has become what we call an operating department practitioner. And they're individuals that sometimes you don't always meet or associate or spend much time with, because they will be supporting the theatre staff, the surgeons, etc. during surgery. Individuals also want to change their career because it needs to fit around their home life. Okay, so it might be that the career they currently have is actually quite disruptive to home life, and they want more stability. And this is an example of an individual who's become from a food technologist to a podiatrist. And we're talking about here people who work with feet. And I would say that that is quite an extreme change in careers. But again, the individual felt that's what they wanted to do for a better home-life balance. Also, people want to some people can't always get the career as a career profession straight away. So what they may need to do is take on those assisted roles, and that is possible as an allied health profession. You may want to become a support worker, but then you can work through and actually become a qualified registrant AHP at a later date. And we have another example here, and this individual, Victoria, who was actually as a physics technician, went on to become a physiotherapy support worker and is now a physiotherapist. In fact, she's a physiotherapy lecturer down in the south of England. And again, so that shows how your career can develop with the original skills that you may have developed in your early life. And now this individual is actually giving back, and she's helping to support the supply of future physiotherapists. When it comes to a career within as an allied health profession, doesn't always have to be clinical. And we have an example here of Zoe, but also Victoria, where you may want to use your skills as an AHP and you may want to give back in other areas and become a lecturer or work in academia. But as an AHP, there are other clear career routes other than that of a clinical, and things that you may be able to use those AHP skills and those other career skills that you've got are in that of the field of research, public health, education. It may also be that it's management and leadership. So you become a manager and a leader of AHP programs going forward. But also you may become an entrepreneur. So it's your previous career and your current career combined give you the opportunities to drive forward how AHPs can work in the future. So, and this is opportunities that we're always encouraging AHPs to explore once they've actually qualified. So where can I get information from? Well, on the Health Education England website page, there is a page around AHPs and it gives a lot of information. It also gives some articles around those who've done career changing. You'll find the animation that we've created there for you to view. You'll also find some virtual reality. Now, you don't have to have the goggles on to watch this, but you can have a look at the various careers that there are available. And currently, we've created 6 films there for you to watch in a virtual environment if you wish to do so. And that will give you an idea of what it's like to be in that profession. We've also, there's another access there is how you can navigate your route through the education and learning of becoming an AHP. And so there's some information there, but we can talk about that a bit later when we chat with Faye and Zoe. Also, for those individuals who may come from a specific area, we've created an animation for those looking to move from the armed forces. And you'll be surprised how many individuals who were former armed forces personnel who have become AHPs going forward. And you've got so much to give from your former career in the armed forces. Also, we try and support people who may have already qualified as a clinician, but have left the profession, and we help to support them to get back into practice. So if your partner or your loved one was a former AHP, then we can encourage them and support them to return back to practice. The other big piece of I would encourage you to visit YouTube and type in YouTube AHPs. It's a bit of work that we did with the WOW show. So if you type the WOW show AHP on YouTube, you'll then be able to watch some mini films about AHPs. And there's some films about a therapeutic and a diagnostic radiography to compare and contrast exactly what they actually do. And then finally, the place where you're going to find all of this information and about all the 350 professions there are is I would encourage you to visit the Health Careers web page, which is actually going to help and support you through any navigation that you decide to do. So that's what it is to be an AHP. That's what it is to be an AHP and why people change their careers. What we're going to do now is I'm going to bring Zoe and Faye into the conversation. And what we're going to do now is we're just going to talk about some of the things that, why people change their career. Now, Zoe, could I ask you just to give us a bit of a background why you became an AHP and what career you previously had?
Yeah, Paul. So my first degree was in creative arts, and then I worked within creative industry for upholstery fabric design companies, and then worked as a copywriter, editor, freelance, had my family and was looking for some more, job security, something that fitted around, my children. They were still young and at school, but also something that challenged me I wanted to do a job that, you know, I could care for people, but I love that science, technology aspect of things. So looking around, obviously it had to be local as well. I couldn't uproot my whole family, so I could retrain. So I looked to see what was available locally. Radiography was an option. When investigated further, because as you've noted, there's two very different radiography professions, explored both, had visits to diagnostic departments and therapeutic radiography departments, and decided I was going to be a therapeutic radiographer. That was the one that appealed to me. I could see patients on a daily basis, see them for 6 or 7 weeks period of time, and really support them through their radiotherapy treatment. So yeah, so that's my background, and why I chose really was because it was local, because the job, once I qualified, would fit around my family. Even though I worked full time, clinically we don't work weekends in therapeutic radiography, so that was always a bonus. And there's job security. The NHS needs radiographers, so yeah.
And so some of the slides that we saw there, well, you can relate to the reason that people do change their careers going forward. Faye, from a perspective of sort of career changes, and I know Health Education England can support individuals who will go for, what are the key things that you sort of tend to get asked from a career changer perspective within HE?
Absolutely. I think one of the big questions we often get asked is, in terms of entry criteria, what qualifications do I need? Because I may have come from a non-traditional background. How do I get into AHP degrees? And our advice is always check with the institution, the university that you're applying to, because every institution will have ever so slightly different entry criteria. So absolutely check that out carefully. But typically what you tend to look for is 2 to 3 A levels, GCSE English and Maths to grade C, or level 4 now as it is. And really they're the kind of the main things, but our universities do look at other criteria such as lived experience and what you can bring from your previous role as well. So I would say not to be put off if you don't think you hit those kind of traditional entry criteria. There is support available out there as well, if you haven't got your English and Maths, for example. But that's kind of the big question we often get asked, what's the entry criteria academically?
Zoe, is there anything you want to add? Because I'm sure you get, people come to you exactly what as Faye's described. I haven't got the full qualifications, so how can I embark on this change of career? What advice would you give to individuals?
Absolutely. So I think the key things, like Faye's noted there, is the GCSEs, and they're essential for across all of the programmes. So English and Maths, grade A to C or level 4 as it is now, and for radiography, particularly science as well. And those are the key things that you would need. And certainly you can do those at evening school, online, virtually, all sorts of opportunity to do GCSEs. Obviously, we still accept the old O levels as well, for those who are older and did those qualifications. But also think about things like Access, BTEC, other sort of MVQ level qualifications. But sometimes those professional qualifications can be what we call recognition of prior learning. So we could explore that and see what prior learning you have, and if it translates into what we need for you to have to be able to apply for the course. So don't be put off, contact the admissions tutor for the particular course, and they're happy to discuss, have you got something that may not be that traditional route.
I think in some respects as well, is some individuals may have a primary degree under their belt as well, isn't it? And that is definitely taken into account. And some people may want to explore the opportunity of a master's if that profession or the institution near to them is offering a master's as a program going forward. A question I know I get asked is, can I do it? Can I do e-learning, do it online? Well, yes, you can, but when it comes to becoming a healthcare professional, there is an expectation of patient contact. So I think you've got to be prepared to accept that that's the case. And I think you raised a really interesting point there, Zoe, about it had to be close to home. And I should think that's quite a challenge for some individuals, some of our pre-registration students, when we're asking them to travel to placements. How do the institutions try and support those individuals?
Yeah, it can be tricky, actually. If you think about, just as an example, our University of Suffolk is based in Ipswich, and our placements for the radiography programs go as far as Peterborough and Cambridge, and then down to Southend, which is a huge span of East Anglia. So what we try and do, so we always offer students, when they apply or when they have their interview, they would select their placement options. So they would have a first and a second choice. And we always aim to give them their first choice. Obviously, it's not always possible. So students can tick the box to choose placements that are closer to home. And we take into consideration other aspects as well for our mature applicants or career changers. Do they need to be on placement nearer to home? All of the placement sites have accommodation as well. So for those who aren't restricted necessarily by family commitments or caring commitments, they might want to live on site if they're living closer to the university where they're studying, and then live on site at the hospital. So there's lots of different options, and I know other universities as well will give students the opportunity to decide sort of those preferences at that earlier stage.
I think that's quite interesting. I think it probably leads into sort of another area that some of our career changers are always concerned about is the finance behind it, because it's not going to be cheap. Faye, have you got any advice, or is there anywhere people can go for information when it comes to in respect to funding?
Funding's not one of the areas we get asked very often, because our area tends to be apprenticeships, so the funding comes from the government for those. But Zoe might have some info about finance.
Okay.
Yeah,
Zoe?
certainly. Yeah, so the NHS BSA, Business Service Authority, I think it is, they provide learning support funds. So there's obviously the bursary for the allied health professions, and for radiography it's currently sitting at £6,000 a year bursary. There's obviously student finance, so you can have student loans for your fees, your tuition fees and your maintenance loan. And also you can reclaim travel and accommodation expenses. So certainly when I was training, I was travelling 50 miles each way to my placement hospital, and would reclaim my travel expenses. And I drove and reclaimed petrol, and there's a fixed charge for that. Or if you're travelling on train, bus, whatever. Also, if you're staying in hospital accommodation, you could reclaim that expense, and plus a return journey once a week to your main address. So yeah, there is a lot of additional financial support available. It's just investigating. There's also childcare support funds as well through the NHS BSA, for people who obviously have children and need to think about childcare costs.
Okay, so that sort of leads on, I think now allows us to bring in and talk about apprenticeships, because obviously we talked about funding, but apprenticeships is an opportunity of earn and learn, isn't it? And that's a way forward, I think. And I know within the AHP community, it's something that we're exploring very heavily about training our workforce through the apprenticeship programs. Faye, would you like to give us a little bit more information around that from an AHP perspective?
Absolutely, that is one of the big questions we get asked quite a lot. Is, we now see that there are degree level apprenticeships for physiotherapy, radiography, podiatry. I think we cover nearly all of the 14 AHP professions now with some kind of degree or master's level apprenticeship, which is really, really exciting for us in the NHS, because we can attract kind of people from diverse backgrounds, those who have come from non-traditional routes. It's an additional way for us to train our staff. And as you say, it's a way from a learner perspective to not maybe have a student loan and to have your fees paid for via the apprenticeship levy. What we are finding in the NHS though is that our trusts are predominantly upskilling existing staff with apprenticeships at the moment. So we are trying to realise some expectations at the moment around, actually we have these already and it's very, very exciting, but it may be that our trusts aren't going to offer these externally quite yet, but we absolutely see this coming within the next kind of 2 to 3 years, that you will probably see more AHP degree apprenticeships advertised externally on NHS jobs and things like that. So we see it very much coming down the tracks, and it's very, very exciting, because as I say, it just opens up a whole new candidate pool, and it's something that we're really working towards. So yes, it's something, it's definitely one to watch, I would say.
And I think on that, what you just said about, they're trying to, the term we use is grow your own within your own organization. There are opportunities. If you're looking at a career, moving into a career as an AHP, one stepping stone to do that may actually to become a support worker to start with. That gives you the opportunity to understand what that role is about. It actually helps you with that transition. And as you've just said, Faye, if that organisation is keen to upskill its own workforce, it will then actually support your learning going forward. So we do say to individuals, don't always think there is only one route into that as an allied health profession. There are different routes, and I would say it's more about exploring those opportunities. And going back to the slide that I showed earlier about routes into the various professions, which you can find on our HEE website. Okay, well, I'm mindful of the time. So what I'd like to ask Faye and Zoe, what would be your top tips for that of a career changer if they wanted to become an allied health professional? I'll go with Faye to start with.
Well, from my perspective, talking about apprenticeships and widening participation, our top tip is always sign up to NHS jobs and the government find an apprenticeship website, set notifications on there. And as you were saying there, Paul, around our support workforce, don't just set your limitations to, physiotherapy degree apprenticeships. Look for physio assistants and support level apprenticeships as well, because that could be your foot in the door. So absolutely set that search criteria far and wide, and keep an eye out, because I think in the next couple of years they're definitely going to be coming through to fruition for us in the NHS. Okay.
Zoe, top tips for career changers?
I think it's about thinking about what you have to offer, not what you don't have. So don't worry if you haven't got the qualifications. Think about those transferable skills, communication, caring, empathy, all practical skills. If you're interested in science, if you're interested in health generally, all of those things make a great base to start with, and explore the AHP professions. There's, Paul said there's 15, and just look at them, think about which one you would really be interested in, go and arrange a visit day. It's a bit tricky with COVID restrictions currently, but certainly there's opportunity to go and visit departments at different points and just find out more about the job and what the actual profession involves. But yeah, just explore. There's lots out there.
No, I'd agree with you. And I think, we've given you points of access within the HEE website and the apprenticeship stuff, etc. But I would also recommend that you contact the professional bodies as well. Each of the 15 or 14 professions has its own professional body, and they can give a lot of advice and support and give you information about their profession. And I think it might be, they could even put you in contact with somebody. It might have to be done virtually at the moment, but I think, as Zoe said, it's explore and try and understand what that profession is. You've got a career in front of you, and that doesn't matter how long that career is. So it does take time. I think you will get to where you want to get to eventually if you're able to understand the route that you need to take. I'm going to be honest with you, it's not always an easy route. There will be little knockbacks, but at the end of the day, being an allied health profession myself, it's the best career, I think, out there, being a physiotherapist. The opportunities that it's thrown up for me are absolutely amazing. You know, I started off as a support worker and then went off and qualified and have been a physiotherapist. And I've had opportunities to work in a variety of settings and have the opportunity now to drive workforce going forward. Well, I'd like to thank Faye and I'd like to thank Zoe for your time today. Really much appreciated. Hopefully that's given everybody an insight into that of being a career changer and the opportunity of becoming one of those 15 AHP professions that's out there. Remember to use the hashtag Health Careers Live. I'd like to thank you very much for your time. Enjoy the rest of your day and we'll see you as an AHP in the future. Thank you very much.